Hello, everyone. Hi, this is Dr. Michael Klaper, and I want to welcome you to the December 2021 Plant-Based Clinical Nutrition Forum. This is a bit of a special edition in that we usually have a live guest and then a live Q&A. We certainly have a live guest today. Dr. Goldhamer is joining us, and I can't wait to interview him and ask him a whole bunch of questions. But alas, we're not going to be having a live Q&A today because this is a pre-recorded forum. Unfortunately, there was a death in our family. A beloved cousin of mine who I grew up on the farm with and shared many wonderful memories died suddenly in her sleep. And you are seeing this on Sunday night. In reality, I am up in Westchester, New York at her funeral. So I will ask your understanding, and we will go back to our usual live Q&A format when we resume our January forum. However, that said, you're going to get your entire 50 cents worth of value out of this evening's forum. We will indeed have an extensive interview with Dr. Goldhamer, a foremost authority on water-only fasting. And then you've already submitted a ton of questions when people enrolled for this month's forum, that we have a slew of questions. They've already been asked, so relax, we have your questions. Before we get into the focus of this forum and the fasting issues, I do want to just give you a quick update on what we've been doing at Moving Medicine Forward. It's been a busy year for me. I have been giving lectures at medical schools across the country, in fact, around the world. I just spoke in Malaysia. All this is virtual on Zoom, of course. But as you can see, especially in September, October, November, I've been giving lots of lectures to the medical students. Baylor University down in Texas, they were kind of a tough sell when it came to the cattle issues, but they were good sports. But the students universally have been very open to the plant-based message. It really keeps me fired up and focused to get this message out to as many medical students as possible. That said, we are entering into an entire new phase of our function in moving medicine forward. And to that end, I would like to introduce a colleague of ours on the Moving Medicine Forward team. This is Josh Wayne. Josh is just a real valuable player on our team here. He's the development coordinator of Plant Pure Communities and is a recent graduate of the College of Public Health at the University of Georgia. He was shocked, like we all are, to see how both his program and the medical school that UGA is attached to just essentially completely ignore the role of nutrition and health, both in their teaching curriculum of medical students and in the Coca-Cola sponsored convenience store inside the health promotion building, seeking to combat the system that promotes such ill health through irresponsible nutrition. Josh has dedicated himself to advocating for plant-based nutrition and its integration into the medical education system and clinical practice. He supported us on past forums. He's here today to tell you how you can support our mission, which is now entering into a whole new chapter. So Josh, I'll turn it over to you to share our metamorphosis to our viewers.
Well, thanks so much for that great introduction. And it's true, we have a long way to go when it comes to moving medicine forward. And I'm grateful to be part of this amazing team and this larger community. We got Dr. Goldhamer here, and we've worked with amazing professionals. Now, if you've watched these forums and if you've taken the masterclass in plant-based clinical nutrition, then you likely know more about the power of plant-based diet to reverse and prevent disease than the average physician. And after 3 years of successfully working together, the 501c3 nonprofit Plant Pure Communities and Dr. Klaper will expand our collaboration on moving medicine forward into the areas of plant-based networking and small group support. We envision a world where all physicians know the importance of dietary interventions to prevent and treat our leading killers. Together with your help, we can change the way our medical school system treats patients, transforming it from a system of disease care to one of true health. So we're calling on you, our supporters, to help us fully fund this effort. And importantly, we want to hire a full-time strategy associate. So our strategy associate will support lifestyle medicine interest groups on campus by ensuring students are active, effective, and connected with other groups around the country. We'll also connect students with our existing pod network of over 400 plant-based groups around the world so that students and non-student leaders can get together and bring about meaningful change. We know medical students are quite busy, and they need a well-funded support system to help schedule events, book speakers, and collaborate on strategic initiatives. Wayne State shows us that success is possible if we work together. Your donation ensures that students have the one-on-one support they need to effectively change their school's curriculum and move medicine forward. And the last, if you would like to see this recording and have access to the recordings, donors for this initiative will have access, and we'll provide you that link in a follow-up email. So back to you, Dr. Klaper. Have a great day.
Thank you, Josh. And again, let me just reiterate, the reason we're raising funds, we need to hire a coordinator to constantly keep interacting with the young medical students at all these different medical schools to keep their energy up, to make connections with me, with each other. We need a full-time person to really keep that energy at a high level, and we need to pay them a decent salary. So if you can help us with your donations, now we can get this person who is just going to be a key spark plug to keep the energy and connections going in our Moving Medicine Forward initiative. So whatever you can help us with would be greatly appreciated, especially as the year is coming to an end. Okay, this is a forum on fasting. We have a foremost expert on the subject here. So let me give you a little bit of introductory information about both Dr. Goldhamer as well as, what happened to my slides here, as well as let me move this out of the way, as well as the physiology of fasting. Okay, here we are. Okay, so let me make this disappear, hide the floating meeting controls. Thank you. And great, okay. So this is fasting and plant-based nutrition in clinical medicine. And Dr. Goldhamer is the founding director of the True North Health Center in Santa Rosa, California. I was privileged to function as a staff physician on that noble institution for over 8 years and supervised thousands of fasts. Dr. Goldhamer supervised over 20,000 fasts. And they treat everyone with standard Western diseases, high blood pressure, diabetes, clogged arteries, etc. But they also use water-only fasting on a regular basis to help selected patients. And we're going to drill down on that during this next hour. But as Dr. Goldhamer will be the first to admit, fasting is a very, very powerful modality to help reverse disease, but it's the food that you eat after the fast. It's the food stream made of whole plant foods flowing through your tissues, meal after meal, week after week, month after month, year after year, that really transform your body into one that's overweight, hypertensive, diabetic, clogged up and inflamed, to one that is leaner and healthier with open arteries and normal organ function. And what we see at True North every day, it's the most exciting transformation in medicine. Within days of adopting a True North style diet based on whole plant foods with no added salt, oil, or sugar, the obesity begins to melt away, the arteries open up, the high blood pressures come down, the sore joints stop hurting, the psoriatic skin begins to clear up, the asthmatic lungs stop wheezing so much, the insulin receptors clear out, and diabetes gets better. They turn into normal, healthy people right before your eyes, just like Emily here, actually one of Dr. Furman's patients, but he experiences the same things we do. And patients like Emily went on a whole food plant-based diet, 11 months. This Emily, who was taking insulin and 2 medications for high blood pressure, turned into this Emily, normal blood pressure, normal blood sugar, all for medications. This is what I tell them, young medical students, what greater gift could you want to bestow on your patients then regaining their true health. And you can do that with a whole food plant-based diet. But fasting can be a very powerful adjunct to that. And so I'll just bring up our clinical case that we set up for this forum. Ronaldo is a 42-year-old male, long-standing hypertension. He's overweight, 224. BPs are consistently 152/90. The labs are normal, but his creatinine's a bit up at 1.8. Hemoglobin A1C is pre-diabetic, and actually grossly officially diabetic is 7.1%. He takes a diuretic and an ACE inhibitor. Just as a starter, what's the greatest threats to his health? Of course, he's at risk for heart attacks, strokes, blindness, and kidney failure. Would water-only fasting be helpful? We'll meet you at the end of this presentation and you can decide, but is there any risk for him? I will ask Dr. Goldhamer if there's any contraindications to fasting. If he were to fast, how long should he fast for and what should be monitored? How should he end the fast? Is it safer to fast at home? And what would be your advice to him post-fast? So we'll be covering all of these aspects, and hopefully by the end of this forum, you'll be able to answer these questions on your own. So just a quick review of the physiology of fasting. Why would someone want to drink water only for 5 days, 10, 15, 20 days or longer? First of all, what is fasting? It's consuming water only for a specified period of time. Now, this is not starvation. When you are fasting, you are running your body on the energy that's stored in your fat tissues, under the skin, in the abdominal cavity, various places around the body. And as long as there's fat tissue to burn up, you're not burning your muscle or other vital tissues. So that's what fasting runs on, is stored fat, and puts you in a state of ketosis as the fats you metabolize. When you run through all your fats and you start burning muscle for energy, now that's starvation. We don't want to come anywhere near that, but I just want to make that differentiation here. Common benefits. One of the most profound is that blood changes. This is a high water content diet. You're just drinking water, and the blood gets less viscous. It starts flowing more easily. It's more watery. And the blood vessels begin to relax and dilate for a number of reasons. And as the blood vessels dilate a bit, the now less viscous blood flows more easily through it at a higher volume. So more blood flow, more oxygen delivery happens in the tissues. High blood pressures begin to come down. We'll be talking about that. Dr. Goldhamer published a very important study on this. The arteries are more relaxed, but also the kidneys are dumping large amounts of sodium and water. It's often responsible for dramatic weight loss at the beginning, a couple of pounds a day for the first day or two. And it's salt and water out of the tissues. Inflammation begins to subside by day 2, 3, 4, and certainly by day 10 and further on. Many reasons for this, but the gut lining, joints, skin, the inflammation around the body subsides as the body does not want to put energy into inflammatory reactions. One of the most remarkable things that I saw is patients that come in with nasty eczema or psoriasis, and by day 5, 10, 15, you see the skin lesions clear right before your eyes. I had never seen anything like this in my clinical practice. These are usually stubborn, difficult problems. The women especially who comes in with interstitial cystitis, the bladder is irritated from what they've been eating, that slosh around in their bladder while they're sleeping. Well, that gets better often on a fast. Breast masses and fibroids go down as estrogen levels fall. I've seen remarkable reductions in the size of breast masses and fibroids. Malignant tumors. People ask, does fasting work for cancer? Some cancers respond very well. We'll be talking about a patient we have with lymphomas, but they may slowly improve. And there's a number of reasons. As estrogen levels fall, IGF-1 levels drop, sirtuins appear. All these things tend to put the brakes on cancer growth. People report by day 3 or so, they're not hungry anymore in the state of ketosis. They feel energetic, they feel really good. and they feel mentally clear, migraines get better, sinus infections get better, and their taste buds recalibrate. But boy, I'll tell you, after 3 weeks on water, tomatoes and lettuce taste really good. And so cravings seem to subside as well. If there was a pill that did all this, we would be trillionaires by now. But the water-only fast can produce these remarkable changes. Now, Dr. Goldhamer and his colleagues, 2004, published an important study here. This reflects back to Reynaldo, our sample case for this month. 174 consecutive hypertensive patients with blood pressure in excess of 140/90 were treated in inpatient setting, short pre-fasting period of basically fruits and vegetables, followed by medically supervised water-only fasting 10 to 11 days, and then a 6 to 7 day refeed on veggies. Almost 90%, 9 out of 10 patients achieved blood pressure less than 140/90. They normalized their blood pressure in just 10 days on water. Now, the average reduction was 37 millimeters systolic, 13 diastolic, greatest decrease being observed for the patients with the most severe hypertension. I was repeatedly delighted and amazed to see these dramatic drops in blood pressure. Again, if there was a pill that could do what 10 days on water does, we would be a widely prescribed one. But now we need to take advantage of this remarkable physiology. And this is the last one. I could spend the rest of the lecture on this, but so many organs throughout the body get better in the state of the body adopts during a water fast. The brain function increases. There's increased neuroplasticity, increased neurotrophic factors, more mitochondria get created, less oxidative stress. The heart pumps stronger, slower, more powerful. The liver and the muscles both have increased insulin sensitivity, decreased IGF-1 levels. The fat tissues, of course, are melted down as the fat is used for energy. There's reduced inflammation in all the tissues, decreased insulin secretion. The body pulls into a more streamlined state of function. And again, it's a vast field, but I don't want to spend the entire talk about it here, but it's an ancient response. I'm sure a million years ago on the Serengeti Plains, many times our ancient tribal ancestors would have to spend 4 or 5 days till they found the next berry bush of fruit on it, and they had to drink water for nothing but water for 4 or 5 days, and the body learned how to shift into this gear of conservation and efficient energy use. And one of the most dramatic responses we see is in some malignancies. Yvonne came to us, a 48-year-old female. She had swollen lymph nodes the size of hen's eggs in her inguinal and axillary regions. She had a family history of cancer, but no blood or malignancies in her past. A CT scan showed lymph node masses here, sort of right inguinal lymph node. But she went on a 21-day water fast and a dietary plan of the whole fruits and vegetables, and the shrinkage of her tumor cells, with tumor masses, was just remarkable. And a mass like this regressed to a barely non-palpable mass here. And this happened throughout her entire body. It was so dramatic that we submitted the case for write-up in British Medical Journal, which they accepted. And when she was followed up 3 years later, still showed no sign of regression. Now, I can't say that it's the magic cure for every cancer, and it works better for the more liquidy tumors, lymphomas and leukemias, as opposed to very fibrous sarcomas and carcinomas. But the fact that the malignant tissue responds at all is a doorway into something very, very powerful that we should explore. And finally, what matters, of course, I mentioned is, the fasting is wonderful, but it's what you eat after the fast. If you go back to buffalo wings and bacon cheeseburgers, Cinderella turns back into a pumpkin within days. It's shocking how quickly all the previous changes come back with a vengeance. So the important thing is to use the fasting time as a stepping off platform into a whole food plant-based diet so your body can hold on to the wonderful changes it generated. So this is the real source of healing. And the patients, they learn how to fast at True North, but they learn how to eat, most importantly, so they can keep these wonderful changes going at home. If you want to learn more about the mechanics of fasting, go to my website, drklaper.com. I have a video there on fasting that you're welcome to have a look at. So if you think True North may have something to offer for you or a loved one or a patient, if you're a health professional, you can give them a call or get on their website, healthpromoting.com, or call their phone number down below here. Okay, so we will come back to Ronaldo here in a minute, these are the questions. These are just some of the questions. We got about 50 questions were submitted here. We'll start working our way through these. I want to give Dr. Goldhamer a chance to make some sense out of our clinical case here first. So Dr. G, again, thank you for joining us. And I know you've seen many patients like Ronaldo in the past. He's overweight, hypertensive, borderline kidney insufficiency. He's already taken a couple of medications. We know that he's at risk for kidney failure or stroke or MI. Is there any risk for him in fasting? And if he was a good candidate, how long should he fast for, and what should be monitored during his water fast?
Sure. Like any intervention, there's always risks. You can minimize those risks with the necessary prerequisites to any fast, which is a thorough medical history, a proper physical exam, and baseline laboratory data, so that you have a ability to not only assess his medical risk, but also provide you markers that you can use as feedback, so you can differentiate, positive acute responses that occur during fasting from problems. We talk about healing crisis, where the body takes a chronic problem, it becomes acute. That may be very recuperative, or it could also be a problem. So you have to differentiate that. This particular patient, the thing that jumps out right away is that he's got kind of borderline kidney function. So the thing that would be most important in this patient is to make sure that the vigorous process of detoxification and fasting doesn't exceed his adaptive capacities. And so you continue to monitor his GFR and creatinine and make sure it stays within reasonable standards. The medications would have to be weaned off, but fortunately, as soon as you clean up the diet, even before you start fasting, it's likely that you can have those blood pressure levels at a level that weaning medications over a day or two shouldn't be much of a problem in most cases. His blood sugar levels, he has moderate levels of diabetes. Really not going to be too much of a problem as you go into fasting, because blood sugars are going to come down. The only problem would be if you were on insulin or medications. Obviously, the big risk is a hypoglycemic process with a moderate level of diabetes. Now, if that hemoglobin A1C is, say, over 10 milligrams percent, you may have to do a little longer modulation to make sure you don't get into an acute response there. But this is a very good classic kind of a patient that would be oftentimes dramatically responsive to fasting. Like all patients, though, you don't know exactly how long the ideal amount of time to fast is until you see how they respond to fasting. Fasting is not only therapeutic, it's also diagnostic, and how he responds to fasting will give you a pretty good indication of how well he's likely going to be when you go into a healthy diet, sleep, and exercise program afterwards. Healthy people will you'll see their blood sugar levels drop down if they're at producing adequate amounts of insulin. Somebody with tremendous insulin resistance, it might take several weeks of fasting before you actually see a correction. So assuming this person responds, typically this is a patient that's going to be likely fasting for anywhere from 2 to 4 weeks. Occasionally you might have to go a little bit longer, but typically the majority of patients within 2 to 4 weeks of fasting are going to have normal blood sugar, blood pressure, and hopefully his kidney function will be sufficient that he doesn't get into trouble with excessively elevated creatinine levels. Then afterwards, if he's willing to do dangerous and radical things like eat well, exercise, and go to bed on time, we can expect that this person will not only be able to maintain the results, but continue to make progress in the weeks and months that follow. The real issue is, can we get enough intense education done during the process of incarceration to motivate them and inspire them so they're willing to continue to eat a whole plant food SOS-free diet, hopefully feel well enough to exercise, and emphasize the importance of sleep. Now, obviously, there's other variables too. People under tremendous amounts of stress all the time, those stress hormones probably aren't that good for this whole process either. So teaching people that, how to manage their stress more effectively or how to limit their exposure to some extent may also be an important issue. And I'm sure there's other psychological variables and other things that could play an important role for them. But as you said, in my experience, diet, sleep, and exercise are the dominant interventions that are going to be necessary to get well. Fasting is a useful tool to speed that transition and make willingness of a patient to adopt those diet and lifestyle habits more possible. When people feel like crap and they're exhausted and they can't think clearly, it's hard to get them to do the difficult work of eating healthy in a world designed to make them sick. But once people start feeling good and they get a sense of what it can be like not to be sick and miserable, sometimes then it doesn't seem so overwhelming to have to make better food choices, to get off their butt and do some exercise, or to go to bed on time.
You just heard a whole lot of wisdom pour out from Dr. Goldhamer there, and he made a good case about why centers like True North exist, because people can certainly fast on their own if they're basically healthy folks. If you're not taking medication, you don't have serious medical conditions, everybody can do 24, 48 hours on water at home, and even longer. You can increase it up to, at the most, 5 days on your own. But here's a man who's already has compromised kidney function, compromised blood sugar issues, and obviously high blood pressure. And nobody knows how he's going to respond. And Dr. Goldhamer, experienced clinician as he is, said, well, let's admit him, got started on the fast, but let's draw creatinine once or twice a week, and let's make sure that his kidney function are staying normal. We were checking his blood pressure twice a day. Now, even though we stop his medication, I've seldom seen the blood pressure spike up. Usually it just stays nice and modest. He's just drinking water, and that keeps the pressure down. But again, we're taking his pressure twice a day. And that's the beauty about being in a place where there are medical professionals around. So if there's someone who's got some significant medical issues, unless you've got good medical care right at home, you're a live-in doctor there, these people belong in a center like True North to see if there are people to look after them during the fast and see how their particular fast goes.
One of the things that as you know, Michael, is this patient is being medicated for the diet that causes their hypertension. They're not being medicated because they are overweight or that they have high blood pressure. They're being medicated because they're eating a diet that causes it. The moment you change that diet, within days, those pressures are going to start dropping, and the impact of diet is far more powerful than the hydrochlorothiazide and the lisinopril that they're taking. And so we can have a big enough influence with diet and lifestyle change so that those medications are almost in all cases going to be able to be weaned without the person having a dangerously high reactive hypertensive response. And then the impact of fasting is far more powerful than any of this. You're going to see a big drop. In fact, one of the concerns would be if you did try to fast people on these medications is you could actually get some really untoward orthostatic responses and dizziness, put the person at risk and danger. In fact, that's one of the problems that people have when they try to do these things without a proper support and environment, is they just make a lot of mistakes, and it can make fasting look more dangerous and more difficult than it actually is.
That's a good point. Not only can we get people off medications, we have to get them off because their pressure will drop too low.
Right.
Same thing with blood sugar, with insulin, man. You got to get them off.
And unless they go back to the diet that's causing hypertension, we don't expect them to have to go back on medications. Most of our patients, even without 100% compliance, just decent diet and lifestyle compliance, can do far better off the meds than they ever did on the meds.
Very well said.
And they don't have the chronic cough, fatigue, impotence, and premature death that's associated with these medication profiles.
Small feature there, but yeah, that's very, very important, of course. So let's talk about some of these classic questions here. It'll certainly take up the rest of our hour, no doubt. So is fasting safe? It generally is, unless you've got significant organ compromise, and then you should at least talk to one of the doctors at True North. They do phone consultations to let you know if you're a suitable candidate.
So, we've actually done a fasting safety study. So we have completed the first really comprehensive fasting safety study that was published a couple of years ago, where we looked at all the patients and all the adverse events that occur in fasting. And, that's available on the website. People can look at it in detail, but it is a safe intervention when it's done according to protocol. And of the hundreds and hundreds of patients that were involved in that study, there were no deaths. There was only one category 4 event, which was a hyponatremic event, which was caught and readily resolved during fasting. Most of the stage 3 events were hypertensive crises, because as you know, in these studies, any day a person measures a blood pressure of 160 or higher, systolic blood pressure, is considered an adverse event. So a person coming in that's 220 over 110, capped on in meds, and then they go down to 200, then 190, then 180, then 170, every one of those is an adverse event. And in fact, a third of our stage 3 adverse events were just that, hypertensive patients that were progressively improving during the process, but because of the technical ways that these are reported, each one of those counted as adverse events. The reality is that most adverse events that occur in fasting are expected, normal consequences of fasting. The low back pain, the headache, the nausea, the skin rashes, the things that happen as the body's unwinding the process of toxicity and healing itself. And so now we actually have that, which is usable for not just us, but anybody using this protocol can rely on this fasting safety study as justification for IRBs to approve fasting. And we also found that, in the past, there was some concern about people that were really old, like over 65, and were considered too old. But now we know that the intensity of adverse events or frequency of adverse events don't substantially change based on age. So even if you're really old, like 66 or 70 or 75, fasting can still be for you.
Well said. So we've got a lot of health professionals with patients who they think might benefit from fasting or would want to fast themselves. They have borderline blood pressure a little bit up. They have some weight to lose. Is fasting at home safe to do? What is True North's philosophy on fasting at home?
Fasting is not only safe, we recommend everybody fast every day for between 12 and 16 hours. So the idea of having to eat from the time you wake up to the time you go to bed at night is probably a significant mistake. We recommend people do not eat 3 to 4 hours before they go to sleep. They may even want to delay breakfast in the morning so they can do a little bit of exercise and preferentially burn fat, and particularly visceral fat. And so that fasting we think is safe for virtually everybody, doesn't require medication modulation or other things. I'm not a great big fan of the 2-day fast kind of thing, because the most expensive period of fasting biologically is those first few days of fasting, as the body adapts to the fasting state and goes into the protein conserving phase. So when you're doing very short periods of fasting, there's a higher ratio of gluconeogenesis is induced, because after about 48 hours, you've depleted your glycogen stores. The only place the body can get glucose from, particularly if you're being active, as people typically are at home, to support muscle activity and brain activity, is through gluconeogenesis. So you're going to get a disproportionate amount of muscle breakdown, whereas if you're in the resting state, and particularly proportionally over a longer period of time, the vast majority of calories that are burned is derived from fat. In fact, it's interesting, we finished a study that we did. We got a DEXA scanner on board, and we went in and looked at body composition changes during fasting. And now we know, with a study that will be coming out this year, that not only is fat preferentially burned during fasting, but visceral fat is preferentially burned. So, for example, in a patient that may fast a couple weeks that loses 4% of body weight may lose 20% of fat and as much as 50% or more of visceral fat. But the visceral fat is disproportionately, preferentially mobilized during water fasting. And during fasting, you do lose protein, water, fiber, glycogen, and fat. But what you gain after fasting is water, glycogen, protein, and fiber, not fat. In this study, it shows that the fat loss continues even as the weight recovers, because the weight that you're recovering is rehydrating, replenishing glycogen stores as much as a pound or two in the muscles, rebuilding the limited amount of protein that is lost, and putting some fiber back into the gut. So fat goes down, visceral fat preferentially. The other materials are replenished during recovery. And we've got some follow-up data now, which I think you'll be excited about, Dr. Klaper. We've got some 6-week follow-up, and now we've got 1-year follow-up. And we're showing, interestingly enough, that it's actually sustainable. The only hiccup is you have to continue to eat a healthy diet to get the good long-term results. But what we've shown is at least these subjects were able to sustain enough dietary compliance and adherence in order to sustain not just weight loss, but continue to reduce percent body fat, replenishing lean tissues. And it's really exciting. And this data will all be coming out this year. A lot of it's in review, or it's getting ready to be submitted.
All right, that's exciting. So let's say a person basically healthy, but they're feeling just overweight and clogged up and too many restaurant meals, and they would like to do a 5-day fast at home to clean out. What should they do in the days going into it? What's the best way to prepare for it?
So whether they're going to fast at home or whether they're going to fast at a facility, the basic requirements are the same: history, exam, and appropriate baseline laboratory. So the way we do remote fasting for patients is if they have a cooperative doctor, that doctor takes a history, does an exam, gets baseline data, and makes provisions for providing appropriate monitoring. Then our doctors can coach both the patient and the doctor to help the doctors know, what to look out for and that kind of stuff. We don't recommend that patients fast without history, exam, lab as a baseline. Even the short fast, you have patients, particularly medicated patients or people that have history with dysrhythmia or atrial fib or other issues, can get into trouble sometimes relatively quickly, usually because of complications around medical management issues. But even not always that. Occasionally people will develop dysrhythmia or other issues. They may not have been aware of the underlying problems, and the electrolyte shifts or other things of fasting can bring it out. So history, exam, and lab for everybody, and then the best preparation is a whole plant food SOS-free diet. SOS stands for the International Symbol of Danger, but it also stands for the chemicals that we add to food that make people fat, sick, and miserable. And those chemicals are salt, oil, and sugar. Salt, oil, and sugar are not foods. They're food byproducts. They're concentrated chemicals that are added to food to fool the satiety mechanisms in the brain and lead us to overeating. That's why people are overweight. That's where metabolic syndrome comes from. And that's where the diseases of dietary excess fulminate and flourish. So we want people off animal foods, oil, salt, and sugar. We want them eating fruit, salad, and steamed vegetables as much as they want, but nothing else. So no coffee, alcohol, or animal foods for a few days prior to fasting. If they do that, they're already going to be kicking in the healing responses even before they start fasting. In fact, it's interesting now because True North Health Center tends to be booked out and it takes people a while to get in. They're sometimes working with our coaches remotely on the phone. And many of them, before they even get to the center, they've already normalized their blood pressure and their blood sugar levels. We've had patients admitted to studies that by the time they came in, they no longer qualified because they were already better. And so, we can live with it. It's okay. But nonetheless, it's amazing how well, if people really take it seriously and apply these principles, even before they get to fast, how well they do. Now, on the other hand, some people, despite their best efforts with diet and lifestyle, whether it's because they're having trouble complying or they're complying, but they're not responding quickly enough, fasting is a really great tool. And also, particularly, you want patients, when you're getting off complicated medications, to be in a controlled setting so that you withdraw them appropriately, not too quick, not too slow, and that, make sure the patient is being monitored properly. The main benefit of fasting in a controlled setting is you have an environment where they're not distracted into doing stupid things that get them into trouble and passing out and having problems and getting stressed out by all the well-meaning relatives that think they're going to die. I mean, let's face it, Michael, most people think if they got on a plane in New York and they flew all the way to California, they'd die over Colorado if they didn't eat the peanuts. They think those pretzels saved their life. So there's a lot of anxiety out there around fasting, both amongst practitioners as well as amongst patients, and certainly among relatives. And so it's hard for people that aren't really well-versed in this to be comfortable in a non-supportive setting. That's why we recommend fasting be done in a controlled setting whenever possible, or at least in conjunction with their physician who's willing to monitor them and, and take advantage of the ability to make this a safe experience.
Well said. So they're going through their 5-day fast. On day 4, They have a very generous bowel movement, and
Yeah.
they're puzzled. They're amazed. I haven't eaten anything in 4 days. Where did that come from? Why does that happen?
Well, remember that a stool is largely bacteria, and a typical person has about 5 pounds of bacteria living in their gut, and a healthy person on a plant-based diet may have 1,000 strain of bacteria living in the gut. It may be more the diversity of the microbiota that's important for immunity rather than just necessarily how much of any one given component. And so another component in a stool is fiber and water, as well as maybe some stercobilinogen and a few products from the liver. So it's not at all surprising to see bowel movements may continue periodically during fasting. Obviously, they're going to diminish as you get farther and farther into the fast because there's less material to move. But a lot of people will eliminate the last materials that they'd eaten that managed to work their way through the gut during fasting, which is why it's so important that the days before fasting, you make sure that those are all soluble fiber type foods, not greasy, slimy, dead, decaying flesh that's going to become a brick and create something that's going to have to be manually disinfected or dealt with. If people eat the food that your bacteria flora are designed to eat, that is the soluble fibers, that's going to be what's going to flourish and support that microbiome, such an important part of our, apparently an important part of our immunological function.
Excellent. And so that's why when we said fruits and vegetables only for 3-4 days, whatever you're eating is going to sit there. And man, you don't want white bread and decaying flesh, like he says. The first bowel movement after that is a bowel movement from hell. You really want that fiber in the gut with plenty of water.
It's real interesting. The fasting, like we have a lot of staff here, they periodically fast preventatively. Their fasts are incredibly boring, because they go on, they're fine, there's no excitement, nothing clinically that interesting. And it's because they've been eating well all the time. Whereas you get people that come in, particularly if they don't follow advice, they don't lead in properly, it can be really entertaining. You get to see everything that you can imagine in sick people that try to do fasting without proper preparation. In fact, we didn't know how important that was early on. And so we would advise people to eat well, but we didn't really emphasize it to the degree that we do now. And since we've done that, the clinical entertainment that we see early in fasting now is dramatically less than it used to be. It used to be there was always stuff coming up. Now, it's relatively predictable. We don't have that much excitement now, which is a lot better for the doctor's sleep habits and patterns. And, we have a lot less concerns and stress we can handle, and it's just getting them to eat properly in preparation for the fasting experience. If they don't do it on their own, we do it at the center. Excellent.
So they made it through their 5 days. They're feeling better. They're feeling light. They got to get to work on Monday morning. It's time to break the fast. So what's the best way to break this fast?
It takes about half the length of a fast on average to go from the fasting state back to the refeeding state. So if you have a 5-day fast, you're going to need 2 or 3 days to properly aliment. What we do at True North Health is we like to start off with fresh fruit or vegetable-based juices or combinations of that. And the reason for that is, and particularly on longer fasts, if you do a few juices and there's any issues, there's no fiber, there's no difficulty, those issues tend to be short-lived. If you give people a very robust meal, you can get into some symptoms that last a lot longer. Also, you can't eat very much when you come off the fast because you feel full. You haven't eaten anything. The fiber takes up a lot of space. Very difficult to overeat on whole foods. But if we want to get 600 calories into the person to get them out of the fasting state back into the feeding state, the best way to get 600 calories in is 4 juices. If we try to give you 600 calories of salad, that would be 6 pounds of salad. That's not going to happen. And even fruit, it's a pound of fruit and 3 pounds of salad. To get those 600 calories, we wanted to convert that metabolism back to the feeding state. The most efficient way to do that usually is combination of fresh fruit and vegetable juices. Then if that goes down well, then we introduce fruits and vegetables. Now, sometimes, depending on the person's medical history, if let's say they have ulcerative colitis history or bowel issues, you might want to start them on steamed or starchy vegetable materials because the excitement of those raw foods may be a little too much for some bowels. So you have to know the medical history to know exactly how you're going to refeed. You also want to know what's the person's history and sensitivity to food sensitivities and other issues. Maybe this person's had citrus sensitivities. You wouldn't want to break it on orange juice and things like that if you know a person's going to be sensitive to that. So there's a little bit of fine tuning. It's always going to be whole plant foods, but depending on the patient, their history, what might depend on how you're going to terminate the fast. The principle, though, is 600 calories day one, whether it's juices or whole foods, then trying to gradually increase the caloric level so that by the time you're half the length of the fast refeeding, the person's eating a whole plant food, SOS-free diet, and getting enough calories to sustain their energy and function and, get back to hopefully a healthier way of living. The one problem is if you do a very short fast, but you're pretty toxic, you may not have completely cleared everything. Well, the body doesn't stop detoxing just because you start feeding. It's still actively mobilizing and eliminating these accumulated intermediary products of metabolism. And sometimes that's associated with not feeling so good. You can get bile dumping out of your liver because you've been eating too much greasy fat. And that yellow-green bile can be caustic and irritating. It can cause some diarrhea. It can cause nausea. It can cause vomiting. You may have some other symptoms that come up, skin rashes and other things that are generated by the body as it's reducing the total load of various materials that have accumulated intracellularly. And so just because you're feeding doesn't guarantee that all this active detoxification stops. That's why ideally you fast long enough to get through all that acute stuff, get to a period of stability, and then carefully refeed. I think the refeeding part of fasting may be the most important part. And that's the part where often people make the most mistakes. Too rapid a return to feeding, particularly in long-term fasting, can be very serious. It can be associated with refeeding syndrome. It can be associated potentially with death. So if you have a very long fast and you get a person doing really inappropriate refeeding, that person can get post-fasting edema. They can get all kinds of digestive distress. It can be a really serious problem for particularly vulnerable patients. Refeeding half the length of the fast under supervision is such a critical part of recovery that we won't engage a patient for fasting unless we know we have enough time to properly realiment them.
When I was supervising fasts there, especially if it was 5 days or longer, I was one of my preferences. We always had big, huge bottles of vegetable broth available to us, which is the cooked up tops of all the green vegetables, yellow vegetables, etc. And it's very rich in potassium and natural electrolytes. And so I find, especially after just drinking water only for 5 days, I usually start them with sipping a glass of vegetable juice over vegetable broth. Over an hour or so, just to give their system a little potassium there. And then if they really want something sweet, we can move on to chunks of watermelon or cantaloupe. And if they don't want to, if some people don't want anything sweet, then we can bring them boiled zucchini chunks or a very dilute broth-based soup with some very overcooked vegetables floating around in there, and gradually ease them up to this 600 calories, but do it gently with the high water content foods. Number 4, I hear people say, well, I just want to come in and do a juice fast. Well, the first day I got there, Dr. Goldhamer sat me down and he said, let's go through the physiology of fasting, what you're really going to see here, and let's go through some of the lab changes, etc. And he talked about the concept of juice fast and said, especially if there's fruit in it, but even mostly, even the vegetable juices, this is not a fast, it's a 600 calorie liquid diet, right. And they don't go into ketosis. But do you have any clinical uses for vegetable juices?
Yeah. So, the thing about a juice fast of any kind, whether it's fruit, vegetable juices, however you put it together, the big advantage is that if you say to a person, we're going to reduce your calorie intake to 600 calories, you could do that with a pound of fruit and 2 pounds of salad or 3 pounds of salad and get much the same kind of clinical changes that you'd get with juices. But the ability to get people to do that initially while their palate is still perverted from their previous diet is harder. The juices, they taste more attractive to people because the sugars are released from the cells, they taste sweeter, so there's a palatability. Also, by eliminating the fiber, you give the bowel a bit of a rest. That for some patients has some utility as well. So it's not that there's not benefit to going on juices or broths and things. It's just, it's not fasting. It's the same benefit you would get getting people to eat nothing but 600 calories of healthy food every day. And in some cases, I think that might even be preferential. Just get them, and we do that a lot. Mike, we'll give them a couple big salads and a little bit of fruit, and that's enough to kind of stimulate the healing response. but it's not fasting. There's a unique physiological adaptation that occurs when there's no calories. The natriuresis, a lot of the mechanisms that we can talk about that associate with fasting wouldn't occur in that modified version. Lots of things good do occur with modified feeding, just not the same things as fasting. It's not the same thing. In some ways, it's better because you don't get that intense healing crisis either. So it's a little slower, it's gentler. Honestly, for most people, especially in a home setting, that is something we'd recommend they do. Rather than try to do water-only fasting, do a 600-calorie vegetable juice and broth and all that. Much safer for them, much less likely to get that acute process. Now, it's slower to heal, and things won't happen quite as quickly, but in a non-controlled setting, maybe slower is better. You don't always want the intense, what I call entertaining, clinical response that's associated with fasting. But we can't pretend that we're going to get the same changes in, say, a few weeks of juicing that we would in a few weeks of fasting. It's a completely different physiological adaptation.
Good point. And so people who are just putting their toe in the water, getting to use how can I actually do 5 days, without solid food? A good way to start would be a period of a juice cleanse for 3 days, 4 days, 5 days.
The best way to start would be, if they could, eat a healthy whole plant food SOS-free diet for a few days. That's hard enough for most people. And then after they've had history exam and lab, and we know that there's no contraindications, they've talked to the doctor about any medication manipulation issues, because even that 600-calorie diet still may require modification of their medication profile, depending what drugs they're on. So we want to be real clear that, especially patients that are not familiar with this type of thing, they definitely want to talk to their doc about what drugs they're using and how those drugs need to be modified. Diabetic medications are particularly important, that people are on a rainbow, because too much insulin, for example, can be really, really serious problem. You do not want hypoglycemic crisis, and that absolutely can happen if people don't regulate their medications appropriately.
Number 5 here, the issue of intermittent fasting. This is a novel concept, but it's an important one. And while we're sleeping, you wake up in the morning, you've been fasting all night, of course, you should have been. So the body is not in a complete full fasting state. You're not in ketosis, but already the gears are starting to turn in the cells there. You're already starting to excrete waste out of the cells. The level of sirtuins and beneficial molecules are starting to increase. Autophagy, where the cells start cleaning up debris with them, that's starting to happen. And so the idea is, if you're waking up in that state with these early changes of fasting, just starting to have benefits in the body, keep it going all morning. You don't have to run down to the table and shove a bunch of sugar in your mouth. And most people aren't even hungry in the morning to begin with. You ask, are you hungry? Nah, I'm not even hungry in the morning. Then listen to your body and coast on that all morning, and wait till 11 or noon, and then have the salads, and then start your eating day then. And you'll get an extra 4 hours every morning of this cellular clean out. And that's the idea. And doing this week after week, month after month, really starts accumulating some good changes in your body. That's the idea behind intermittent fasting. And
there is some literature that shows that exercising in the morning before eating actually preferentially mobilizes fat reserves. Walter Longo's done a lot of work on intermittent fasting and its effect both in animal and humans. And the idea is that eat that little bit of fasting, but cumulatively, day after day after day after day after day, may have some benefit. At the very least, not eating 3 to 4 hours before you go to bed means you haven't filled yourself full of glucose that has to be stored as fat, because you're certainly not going to be able to burn it efficiently when you're sleeping. So from a weight management standpoint, many patients find it helpful. We've done this for 40 years. We've fed people on an 8 or 9 hour feeding window at True North Health. I do that myself. I find it's a very helpful tool, and the literature is just starting to come out. As I said, Longo's group is continuing to put more and more information out about what effect this type of intervention may have.
Yeah, I agree. I do my workouts in the morning on an empty stomach. I feel much better, much lighter. I get a lot more workout in if I haven't eaten a big, huge breakfast before.
The reason why people wake up so hungry, in my opinion, is that they've eaten all this sugar, which drives their insulin up, which drives their sugar down. Their brain thinks they're starving. They're getting all this binging and craving because they've been banging their blood sugar and insulin levels around. Once people go on a whole plant food SOS-free diet, their blood sugar levels and insulin levels become much more stable. They don't feel so inclined to have to rush out and constantly be shoving stuff in their face, because their brain's not fooling them into thinking they're starving, even though that's not the case at all. But you're just not designed to be fooling those and pounding on those insulin production mechanisms by putting all this refined carbohydrates into people. And so a lot of the binging and the craving that people think are psychological eating disorder oftentimes are biologically driven because of poor diet and lifestyle choices. And then when you stop that and you get up and you do some exercise, that tends to stabilize the situation even further and reduce insulin resistance even further.
Well said. And that nighttime eating really, that nighttime sugar eating really sets you back. You don't go into ketosis for hours after that. It really messes up your metabolic clean out schedule there. And I like Dr. Furman's admonition. After 6 or 7 in the evening, the restaurant is closed. You'll be done with eating there. And that's a good way to look at it.
I see here you've got this fasting mimicking question up here.
Yes.
And that's I think a really important issue to address because again, Longos and others have done work on fasting mimicking diets, and they have supplemental products that you can take that basically the idea is try to mimic the tremendous benefit of fasting while you're still eating. And so the way you do that is you eliminate your normal natural fuel, which is carbohydrate, and put people on a high fat, high protein diet. Now it's true that on a high fat, high protein diet without your carbohydrates, you will go into ketosis. And one of the mechanisms of fasting is a hunger blunting effect of ketosis. But what's good for short-term weight loss is not necessarily good for long-term health. And so what people are doing to try to facilitate weight loss may be detrimental in the long run to their health. So if you want to lose weight quickly, just cut your leg off at the hip. It's 40 pounds overnight. You don't even have to change your diet. If you want to get 80 pounds off, cut them both off. But that doesn't necessarily mean that's healthy. And so what you do to compromise your long-term health for the benefit of short-term weight loss, I think needs to be done, really take a look at that critically. And so rather than putting people on a fasting mimicking diet, what I'd rather people do is go on a whole plant food SOS-free diet. Men lose 3 pounds a week. Women lose 2 pounds a week on average with moderate exercise and adequate sleep. That's 100 pounds a year or more. How much faster do you need to lose weight than doing that? I don't think it's necessary for most cases. And if a fasting mimicking diet is done for some other reason, realize it may be a short-term intervention, not a long-term diet strategy. And we know now from the literature that's coming out, people that adopt these high-fat, high-animal protein diets get a whole host of health compromises. Even if they did get some short-term weight loss, the long-term health compromises, in my mind, outweigh the short-term benefits. So if it's going to be used short-term, don't consider it a long-term strategy.
Well, you've put your finger on the elephant in the room, a strange analogy there. But so what about the person that, I want to do a 30-day fast. I've got 40 pounds to lose. I want to do a nice long fast to melt this fat away. What's wrong with that? Fasting works for weight loss, doesn't it?
Yeah, well, fasting works for weight loss, but the thing is, fasting for weight loss, unless it's associated with diet and lifestyle change, is going to be very short-lived, and that's the bottom line. Fasting, if it's used to detoxify the body, motivate the person to be able to get feeling good enough to make the diet and lifestyle changes, it may be a useful tool when it's done appropriately. But if the only concern were weight loss, the best strategy is a healthy diet and exercise program. And again, if you're a male, you can expect to lose 3 pounds of weight a week on average down to optimum weight. If you're a woman, it's 2 pounds. Women lose about 50% less weight, everything else being equal, than men, in part because they're full of estrogen compared to testosterone in males. It's interesting, if you inject enough testosterone in women, they'd lose their fat. And of course, they get hairy and get cancer and die, so it wouldn't be a good strategy. And if you inject men with estrogen, we get breasts and hips, don't we? So these biological differences are because women are designed to store fat to survive a period of biological vulnerability called pregnancy. So it means if you're a woman, you do have to work harder compared to if you're a man in order to get proportional weight loss. Doesn't mean you can't do it. It's even easier. They say that women don't have to actually, if they just walk by the buffet table, they gain a pound, a bad dream's the dress size. There may be a little bit of truth to that it is harder. Husband and wives that go on diets together don't lose weight at the same rate. So, we don't make the rules, so don't get mad at us. It's just, if you're a woman, you recognize you have to control your diet, maybe even proportionally more so than your husband, who, you know, snuck out and had some In-N-Out burgers and still lost weight, whereas you're struggling to get those even few ounces off. So that's just how it is. But I don't think that fasting is going to be seen as a primary weight loss tool. Weight loss is an inevitable consequence of getting rid of the reason you're overweight to begin with, which is the food that you're putting in your mouth.
Well said. What he's saying is that the beauty of a diet based on whole plant foods, it's all the vegetables and the soups and the salads and the steamed greens, they're mostly fiber and water, and it doesn't stick to you. You're filling your belly up with a fiber that you pass out in a bowel movement and water that you pee out. And the calorie density is so low that your weight comes off. You can't help it. It's really hard to hold weight on this kind of diet there. So let the food do it, not the fasting. Fasting is not about weight loss. It's about health. And even then, it's a jump start to a healthy diet. It's not
the one caveat I would say to that, Michael, is you get a person on a good diet, they've lost weight. Sometimes they get to especially women will get to a point where they have that last 5 or 6 or 10 pounds, and it's really difficult. It's not so hard to keep it off, it's hard to lose it. And part of that's because the brain is saying, wait a second, we want those extra fat stores. What are you doing? You're hemorrhaging strategic fat reserves. Stop it right this, and no more salad. That's not going to get the job done. Whereas sometimes, and we know now that during fasting, in a resting state, visceral fat is preferentially mobilized. So there may be some utility after the diet and lifestyle have been fully integrated to get that last little bit of issue, that last atherogenesis, that last little bit that might happen a little bit more efficiently with a fast than it might be with feeding. Although if you're diligent enough, long enough with the diet and exercise, you probably still get to the same place whether you fast or you don't fast. But, you know, having said that, I do see there's some potential utility, specifically therapeutically, when you have people that have significant atherogenesis, you can get some preferential mobilization so you can bring that pressure down quicker than you might with dietary change alone.
Fair enough. So it was an eye-opening experience one morning at True North. I was making rounds with you, actually, and we had a couple of patients who saw a woman with rheumatoid arthritis who got a great response during her water fast. That her pain really subsided. She was able to close her fist for the first time in years, but she started eating again, and within a few days, the pain had, a lot of it had returned. Similarly, we had a patient with psoriasis, and I was amazed to watch his psoriatic plaques get much, much better, though they weren't gone. And with both of these patients, you say, oh, some people have to come back and do repeated fasts a number of times. And that was an interesting concept to hear. And but I realized that there's definitely a technique and a rationale for that. So this question, how often can they fast? Who needs to fast often or more often? Tell us about.
So the real problem there is that if you can fast long enough to lower the total body loads, but you can't always do that. Sometimes people's potassium starts to drop out, or they've only got so much time because they've got jobs and lives and kids and other things. So you can't always get everything done like we might like in a single fast. And some people, even if they do long fasts, it'll take several long fasts to undo a lifetime of abuse. And so we don't know when we go in exactly how long to fast. We don't know how many fasts, except when we look back clinically, you see, you mentioned psoriasis. We just published a paper on plaque psoriasis that showed really dramatic pictures and changes and long-term follow-up, I want to mention. And sometimes you'll see improvements, but it continues to improve as they go home. And it may not be till 6 weeks or 6 months till everything's fully resolved. Or it may be that they reach a plateau and we have to bring in fast them again. So let's answer your question though. How often can people fast? Here's some general rules of thumb. The answer is however long it takes to fully nutritionally replenish them before you fast them again. You don't want to go into a depleted state into fasting. But general rules of thumb, a very long fast, like a 40-day fast, the narrowest we've ever refasted a 40-day patient was 6 months. And typically we recommend a year of replenishment. That means a year of healthy eating before we go back on another 40-day fast. On a 30-day fast, it's about 3 to 6 months. It's about half that much time. On a 3-week fast, it takes about 3 months. On a 2-week fast, it takes about 2 months. So there's it's about a month per week, more or less, a little bit longer as you get farther. The deeper the fast, the proportionally longer the replenishment. So a typical fast of 2 to 3 weeks, we would want to wait 2 or 3 months before we would do another fast. Now, the good news is many times, if the people stick to the diet in those 2 to 3 months, we may not need to do the next fast because they're already better. But if they're not, despite their best efforts, we do it again and we do it again until we get people well.
Perseverance furthers, as the I Ching says, and it certainly applies to fasting as well.
The other application is healthy people. We don't fast very long. We're doing 5 to 10 days of fasting, and people that are they're not on drugs, they don't have blood pressure issues, they're basically healthy. We'll fast them for 5 to 10 days. The idea is to fast until there's no symptoms. Many times there's no symptoms at all. If they're asymptomatic after 5 to 7 days, we call it a day and wait till next year. And what we've found now, you don't know this because this data just came in. We've been looking at biomarker changes in sick people all along, and you've seen the tremendous changes. But we took a bunch of healthy people and we also looked at their biomarkers, and it turns out proportionally, healthy people get as much or more change to the positive than sick people do. And the claim that some of the best benefits of short-term fasting may be actually healthy people using it preventively looks like it's actually true. And we've actually got enough data we're going to be able to turn a paper out looking at that issue. And the analogy that I use is that, you know how you go to the dentist and you get your teeth cleaned once or twice a year to try to get the plaque off and just not wait until your teeth are rotted out, right? Well, the idea is you accumulate materials in your cells, even for those of us on healthy diets. You know, we're still breathing the air, we're still drinking water, we're still getting exposed. Occasionally, some people even vary from an exclusively whole plant food diet. And as a consequence, we can accumulate some intermediary products of metabolism in our cells. We're also aging. And it may be that doing that periodic prophylactic fasting may turn out to be a useful way, like getting your teeth cleaned, of dropping the intracellular load enough to prevent problems before you become symptomatic and healthful and health compromised. And you know, more research will tell us for sure, but I believe that's what we're going to find, is that the occasional 16 hours for everybody every day and the occasional longer fast may turn out to be very helpful at slowing the aging process, facilitating rejuvenation, and allowing people to stay healthier longer, just like preventative dentistry care may prevent cavities.
Talk some science to us. Which biomarkers have you been following that are changing?
Okay, so one biomarker, which is a really good one, is weight. It turns out the fatter you are, the worse it is, and particularly percent body fat. Another biomarker, probably one of the most sensitive, commonly used biomarkers, is blood pressure. And for every point systolic blood pressure is reduced down to probably as low as over 90/60, there's a 1% reduction in all-cause mortality. So even people that are supposedly normal at 120/80, that go on diet and lifestyle changes, their blood pressure will continue to drop, oftentimes to 90 or 100, over 60, over 70. And that difference, even the difference between 120 and 100, is probably tremendously clinically significant. Pito and others at Cornell did some research showing that that benefit continues maybe as low as 90/60, which it turns out actually may be more healthy blood pressure than is 120/80, which is more common. Just like if everybody's fat, being fat becomes normal, but not necessarily healthy. And so now the other acute phase reactive proteins, things like C-reactive protein. There's also, so there's improvements in blood pressure in healthy people. There's improvement in blood sugar levels and insulin levels. If you do follow-up data, you'll see improvements in HOMO-IR, although not right after fasting, because there is an increase in HOMO-IR initially after fasting, as there's something we're just learning about how insulin actually responds to fasting, and it takes some time to recover. That's why you wait about 6 weeks post-fasting in order to take some of those markers to get a true effect size of what's actually happened. So CRP, as you know, probably a more sensitive indicator than, say, cholesterol in terms of cardiovascular risk. All those acute phase reactive proteins respond in sick people, but they also respond in healthy people. And lower levels may actually be what's normal and actually healthy. What's normal isn't necessarily what we're thinking is normal with a lot of these normal biomarkers may not be healthy. It's because healthy people are actually relatively rare when we actually go and analyze them critically.
Mm-hmm. Yeah, unfortunately, that's true. What a state that we've gotten ourselves into, where healthy people are rare.
We've also been doing some more exotic, we've been looking at methylhistidine, and we're looking at some of this more exotic stuff that's not routinely done to look at what's happening to protein catabolism and stuff. But what I would do is I'd refer people to the website fasting.org. Fasting.org, all of these papers that we're doing or going to be doing, it's all posted there. It's all freely available. People can actually look at the research that we've published and that we will be publishing, and that's where it will appear first.
With question number 9, are there people who should not fast? Are there medical contraindications to fasting? And the answer, of course, there is. Or some people who just should not do it.
Absolutely. And that's
Yeah.
also one of the important reasons why physicians need to be at least familiar with fasting so they don't advise people inappropriately. We should talk about some of the most obvious contraindications to fasting. Obviously, the one that jumps right out is pregnancy and lactation. So prolonged fasting in pregnancy and lactation can result in problems. You'll lose your milk production if you're a lactating mother, which can be devastating to a child. Anorexia nervosa, even though these patients want to fast, this is not the same as bulimia and eating disorder. This anorexia nervosa, a neurological condition that does not respond well to fasting. I have not had good results fasting anorexia nervosa patients. I would refer them for psychiatric support, not for water-only fasting. Type 1 diabetics. If people don't produce insulin, they're going to have problems adapting to the fasting state. Of the few patients we've had that have had really difficult medical management complications, they've almost always been type 1 diabetics that we've been trying to do heroic intervention with, or type 1.5 diabetics that really didn't produce enough insulin to adapt to the fasting state effectively. So I would exercise. In fact, now we have a standard. If hemoglobin A1C is 10 or above, we're going to need to do dietary management until we bring in enough control that we can safely adapt to the fasting state. Now, it's true, we have in the past fasted patients with hemoglobin A1Cs as high as 16 and 17. I'm not saying it can't be done, but you better be really careful with any patient that has a hemoglobin A1C over 10. And absolutely, diabetic patients need to be fasted in a controlled setting with experienced doctors that know what they're doing, because you can really get into trouble rapidly with ketoacidosis if patients are not managed properly, because they can start vomiting or getting diarrhea secondary to detox and fasting, and they can dehydrate really quickly. They can get acidotic quickly, and that could be a really disastrous outcome. And sometimes it's not, even in a hospital-based setting, it's not easy to manage and stabilize some of those patients. So, definitely exercise caution. If a person's had a recent stroke, MI, pulmonary embolism, or they have atrial fibrillation on anticoagulant therapy, these patients should not be fasted, because you don't want to rapidly or arbitrarily withdraw anticoagulant therapy, because the withdrawal of the medication and the dehydration physiologically associated with fasting could theoretically make them at increased risk for stroke or clot. Now, we don't have evidence that there's an increased risk, but we also know that fasting is not absolute protection against that. And we've definitely seen people that are capable of throwing PEs or having problems. It's rare, but it can happen. And so we want to be really cautious. Anybody with serious dysrhythmia that's on anticoagulant therapy, they would be better off doing a modified program rather than water-only fasting. If the person has severe kidney disease, you need to be exquisitely careful. Now, our standards are if their creatinine is over 2.0, we're not going to be doing water-only fasting. If it's between 1.5 and 2.0, we're going to monitor them very carefully and make sure that we don't put unnecessary or undue load on the kidneys. Because the kidney's main detoxifying organ in the body, they're going to take a lot of load. If they don't have the capacity to adapt to that, you don't want to end up having difficulties there. Diseases like genetically mediated disease like porphyria, would be a relative contraindication of water-only fasting, and MCAD would be a contraindication of fasting. Medium chain acetylcoenzyme dehydrogenase deficiency. If people can't convert fatty acids to fuel, you're going to have a problem. They're going to develop vomiting and eventually die. So these are rare conditions. MCAD is 1 per 10,000 people. We haven't seen a case of it, but because they wouldn't go into ketosis. So if you dip a urine and you see ketone bodies, they don't have MCAD. Depletion, deficiency, or cachexia. So if you have a patient with a wasting disease and at the end stage of wasting disease, if they have frank deficiency or depletion, you need to replenish these patients before you try to fast them. That wouldn't be a good idea. If they can't safely discontinue most medications, with the exception of maybe thyroid replacement or true hormone replacement therapy, they should not be fasted. You don't fast people on these medications. Even over common medications, aspirin or acetaminophen, these things can be potentiated during fasting. You conceivably could cause damage in fasting you wouldn't cause in the fed state. Patients need to be stabilized off medications before you initiate water-only fasting. The good news is, though, if you're willing to get people to do a whole plant food SOS-free diet, which is why they're on most medications can be safely weaned over time. and they're a whole lot better and safer off most medications than they are on medications. So we would control their diet, wean their medications, monitor them, and then be able to introduce the fasting. Now, that's why some people have to be with us for months. You know, not everybody's here a week or two. We have people here for months, sometimes a year or more, because sometimes it'll take months just to safely get them off their medications. And that's particularly true if they're on neuropsychiatric medications. You can't just stop these medications. You have to be able to get rid of the reason why they're on the meds, and then you can introduce the fasting. And the other issue is if people cannot rest, they should not fast. Because if you're too active in the fasting, if you have to work, if you have to drive, if you have to do this, all you're going to be doing is kicking up gluconeogenesis, mobilizing protein stores. You may still get some benefit, but you're not going to get the benefit you would if you were fasting in the rested state. If you can't rest, do a modified program. Don't do a water-only fast. Do fasting right or don't do it, is my recommendation.
Beautifully answered. Again, it's so great that the doctors at True North are available for phone consultation. If you're a health professional and you're not sure about a patient, run it past one of the experienced doctors.
Absolutely. You know, people can call me anytime. There's no cost. I'm happy to take a call from any physician that has any question about, you know, is the patient a good candidate, or what is, you know, they're doing something with fasting. If you have something about fasting, that's a big part of our mission of our 501c3 nonprofit, True North Health Foundation, is to provide education both to the public as well as professionals. You know, having talked about contraindications, I think we should talk about indications, like who is a candidate for fasting. And the most obvious indication is fasting is people have diseases associated with dietary excess. So people that are overweight and have metabolic syndrome, people that have high blood pressure, people that have type 2 diabetes, metabolic, and all the consequences of metabolic syndrome, patients that have gastrointestinal microbiome imbalances. And so they've got the constipation, the diarrhea, the dyspepsia, the colitis, the Crohn's. These dysbiotic disturbances are often rebooted with fasting. People that have the allergies, the asthma, the eczema, you know, where the body's attacking itself, including, well, interesting enough, long COVID and the loss of taste and smell that's associated with long COVID, as in our experience so far, has been dramatically responsive to fasting. And also, we've been seeing a lot of people that have been having reactions to, unfortunately, COVID vaccination, where they're getting a variety of not only myocardial, but also other symptoms, often the same symptoms associated with getting COVID. And so I'm not sure exactly what's going on there, but those symptoms often seem to be responding to the anti-inflammatory effects associated with fasting, which I guess isn't surprising when you think of the mortality things associated with COVID. It's the same mortality things associated with heart disease and diabetes, and the same obesity, the same diabetes. So I guess it's not surprising that secondary effects appear to be responsive to fasting as well. Other people that respond besides autoimmune disease are people that have dependency issues. They're addicted to cigarettes or coffee or alcohol or sugar. And fasting, it's like rebooting the hard drive in a computer. You know, you turn the computer off and you turn it on and it works. You don't exactly know what changes occurred, but it rebooted the hard drive and now things work better. It seems like it's a reasonable analogy for human beings in fasting. You shut it down, you turn it on, and now all of a sudden, taste adaptations occurred. Good foods start to taste good. There's not such an addictive response to the sugars and the oils and all these highly processed, highly concentrated foods. Smokers, by the second or third day, most people stop complaining about the cravings of withdrawal. Now, some people say it's because they're so miserable with the detox of fasting, they don't think about the cigarettes. But it's not true. The withdrawal effects are facilitated. They happen more rapidly. I'm not saying it's easy, but it's certainly quicker with fasting than in the fed state.
All right, and again, to the health professionals out there, you got to stay a clinician throughout the entire process there. If you have a patient who is, say, in for doing a water fast for high blood pressure, and after 3 weeks, 4 weeks of water, it doesn't budge, it doesn't come down, then you've got to look for other causes. That patient may well have a renal artery stenosis or an adrenal tumor or some other cause, bilateral prostate obstruction of the ureters. There's another reason there. So you got to stay a physician as you're monitoring the shoulders.
Most physicians, when they've done a history exam in lab, they have a pretty good idea if secondary hypertension is dominant. And occasionally we'll see something slip through, but you rarely see that. Very rarely does a secondary hypertension slip through and then we find out later, oh, it's a PHO or there's something else going on. Because usually you can tell by the history and the exam and the lack of response to fasting. Like that red flag goes up. If they don't respond the way we're used to seeing them respond, which is literally in days of diet and or fasting, things start responding. If they don't respond, like you said, there's a reason, and we got to go find that reason.
Well said. So we're coming down the home stretch here, some practical questions here. If I'm a health professional, I want to learn about fasting. As a tool, I'd like to get some facility with, but I don't know how to do it. Where can they go to learn how to supervise a fast?
Sure. Well, we offer free training to physicians. We provide room and board and training to any doctor that wants to learn how to do something really worthwhile with their life. So all they have to do is contact True North Health Center. We'll figure out a time where they can come in. The downside is, in order to get comfortable with this, you have to see enough patients go through the whole process. You can't just, it's not just look up the data is simple. It's the same practices that every doctor does in every practice. But you got to get your confidence of seeing people actually get well. The residents that participate in our internship and residency program, the most common comment I've heard from them is, wow, it's the first time I've ever seen somebody really get well, with blood pressure, with diabetes, whatever. They're not used to seeing that. And we see it routinely. So they've got to see enough people. So they need to be with us enough time so they can be comfortable if they're going to take these patients on. That's really the biggest roadblock for people, is how do they get time off enough to actually do that? The other thing that happens to the interns, residents, and the docs that come and spend time with us, by staying in a place where they're eating healthy, really healthy, for a few weeks or a few months, they themselves go through tremendous health changes themselves oftentimes. And I think that's one of the big benefits, because they see in their own body the transformation that occurs from living healthy and eating healthy. And I think that's one of the biggest influences they have. So healthy people don't need to be here as long, but unhealthy people need to be here till they themselves get healthy so they can really see the full impact of it. And I think that's a really good thing. The docs that come through here, I think, almost always feel like they learn a lot. And even if they understand all the clinical issues, they learn a lot just in terms of patient management and what's involved with working with people on an inpatient setting where they're actually getting well. And so all they have to do is contact us at truenorthhealth.com, and we'll help them figure out some time where we can help them get trained.
Last two questions here. Number 15, we've got a health professional with a patient who I think would benefit from prolonged water fasting, but I've called True North. They've got a month waiting list to get my patient in. Is there any other place I can send them? Do you know any other centers?
Yeah, we have a list that we will provide the closest facility with a doctor that's been trained. We've got people now in Ohio, in Southern California, in Texas, Florida. So there's more and more coming all along. There's plenty of doctors out there. There's not that many facilities yet, but that's starting to change. I think as we publish more material and people realize how effective this is, more and more doctors are going to decide to start adding fasting to the tools in terms of patient management. So they can contact us, and we'll try to put them in touch with people that know what they're doing more close to them than we are.
Excellent. So I have to ask, number 16 there, in your vast memory store of 20,000 or more people have gone through the fasting program, any really memorable ones stand out, people who just responded just jaw-droppingly well?
Well, you mentioned a woman that we published in the British Medical Journal, and you talked about her success with follicular lymphoma, and then you talked about a 12-month follow-up. Well, we now have, and we got a 3-year follow-up that we published in BMJ, and I just got the 6-year follow-up data, and she is now completely cancer-free.
Yes.
She's continued to comply with the diet. She's actually living in Texas now, so despite the challenges of living in Texas, she's doing great. And now since then, and since we published that paper in the British Medical Journal, we've had many patients with lymphoma. Now, the last 2 were stage 4 follicular lymphoma with infiltration into the marrow. And we did 40-day fasts in each of those patients. And the first one, we just got the follow-up CT scan data, and he's done fabulous. And the second one is doing well clinically. We haven't seen the CT data. We think it's good because you can feel the changes. That comes in January. We're going to put all 3 of those together for a follow-up BMJ cohort, which we hope will provide the basis for a prospective clinical trial random assignment condition in the treatment of follicular lymphoma with fasting and dietary change. So we're going to, I think, be able to pull that off once we've got this cohort published. So we have seen now many patients with lymphoma, and they inevitably are responding. Now, the problem is, unless they're willing to do the diet and lifestyle, not all of them are maintaining the outcomes. But the ones that are willing to do the diet and lifestyle, it looks like they can sustain the result. And in the case of that first patient that you took care of, she is 6 years in now. You know, after 6 years, we're starting to get to think maybe there's something to this stuff, you know?
That's wonderful. Oh, yeah, that warms my heart. Good for her, good for you, good for the body and fasting and True North, where these wonderful improvements can take place. I'm sure our viewers have many more questions. Hopefully we covered the main ones here. If there's ones that are just burning that you'd really like to get answered, please send them to movingmedicineforward@drklaper.com. Our young newly graduated Dr. Zach Burns will have a look at them, collate them, and no promises here, but we might just do a separate Q&A session and run through all these questions. So that's the place if you didn't get your question answered. So again, if you now have a passing familiarity with the amazing facility that is True North Health Center, if you would like to learn about fasting, or if you've got a patient who you think would benefit from not just water fasting, but learning how to eat a whole food plant-based diet, which is really the most important thing they can do, give them a call. Or, sorry, I didn't have their website here. It's health promoting, no spaces, healthpromoting.com. You'll see their wonderful website that they have. I want to remind everyone, next month our forum will be held on January 23rd. I guess it's going to be Lori Marbus, who is the Chief Medical Officer of Plant-Based Telehealth, and the organization I work for. And we'll talk about where plant-based medicine fits into this new remarkable discipline called telemedicine. And they're a marriage made in heaven, but there are limitations. So we'll talk about how, if you're a practitioner, how you might be able to use plant-based medicine in your telemedicine practice, or if you're a patient, you may want to understand better if telemedicine and plant-based medicine are a good match for you. And then the following month, February 20th, please plan on attending. Jim Hicks is going to be talking to us about the reality of what we need to do as a species to save our futures. You bet adopting a plant-based diet has a lot to do with it. And I know we talked a bit when we had Glenn Mercer on and talking about his book, Food is Climate. I tell you, engineer, author, and visionary Jim Hicks goes in on such a deep, profound level. This presentation will probably change the way you look at the entire future. So plan on joining us February 20th. Well, I've got nothing but sincere thanks for my friend and colleague, Dr. Alan Goldhamer. Thank you, Alan.
It's my pleasure. Anytime, Michael.
You did just a beautiful job here, and I think we're all wiser for it. I want to thank behind the scenes, Josh Wayne and Carolyn Dyer and everyone at Plant Pure Communities. Thank you, Josh. I know Zach Burns is in the background there as well. Thank you so much. Josh, any last minute comments that we need to make here, or just invite people to go to the webpage and make a donation?
Absolutely. Yeah. I mean, continue supporting this initiative. And, as we see two amazing physicians with the knowledge of the plant-based lifestyle, just imagine if that was 200 or 2,000.